She had a bright future, a rising star in Hollywood. You may remember Kelley Mack, the talented young actress from The Walking Dead. She lit up the screen with her energy, her smile, her promise. But behind the scenes, something silent was growing, a glioma, a tumor deep inside her brain's control center. No loud warnings, no dramatic symptoms, just the quiet, slow fading of her strength. She was only 33, but today's video isn't just about Kelley. It's about a growing risk that many older adults don't even know exists, and it's one that could be silently threatening you or someone you love right now. What is glioma? The invisible intruder. Glioma is a type of brain tumor that begins in the glial cells, those supportive, protective cells that surround your neurons and keep your brain functioning. In a healthy brain, glial cells act like caretakers, but in a glioma, they turn against you, dividing and growing in ways they shouldn't. What makes gliomas especially dangerous is how quietly they move. In seniors, they're often mistaken for signs of aging. Forgetfulness, sudden clumsiness, slurred words or mood swings, they're brushed off. Oh, it's just age, people say. But sometimes, it isn't. Sometimes, it's a tumor growing behind the curtain, until one day, it can no longer be ignored. Why seniors are more vulnerable. As we age, everything in our body slows down. Cells regenerate slower, the immune system weakens, and the brain, it becomes more fragile. So when a glioma begins to form, older brains don't always respond the way younger ones might. The symptoms creep in subtly, until it's too late for surgery, too late for treatment. That's why awareness is everything. And that's why I'm speaking to you, person to person, doctor to patient, because I don't want you or your loved ones to become another silent story. The most overlooked early symptoms. Let's talk about what gliomas really look like in their early stages. These are the symptoms you cannot afford to ignore. Frequent headaches that worsen over time, sudden confusion or memory lapses, vision changes, blurriness, double vision, blind spots, difficulty speaking or understanding language, weakness in arms or legs, especially on one side of the body, personality changes or sudden mood swings. Even just one of these, especially if it appears suddenly or worsens, should prompt a conversation with your doctor. You see, the brain has a remarkable ability to hide damage. It compensates, adapts, until it simply can't anymore. The goal is not fear, it's empowerment. Yes, this is a heavy topic, but you deserve honesty. You deserve information. Because when you're armed with knowledge, you can act early, decisively, and with strength. The types of glioma, what's growing in the shadows. When doctors say glioma, they're referring to tumors that arise from glial cells, the support crew of the brain. There are three main types that seniors should be aware of. Astrocytomas. These grow from star-shaped glial cells called astrocytes. They range from low-grade, slow-growing, to high-grade, very aggressive. Glioblastoma, the most deadly and fast-growing type, is a form of astrocytoma. Oligodendrogliomas. These are rarer and often slower growing, but they can still cause seizures, weakness, and memory loss. Early detection is key for better treatment options. Ependymomas. These begin in the lining of the brain's fluid-filled spaces, ventricles. While more common in children, they do occur in adults, especially older adults, and may cause balance problems or pressure-related headaches. You don't need to memorize these names, but you do need to recognize this. Any glioma can change the course of your life if not caught early. How glioma is diagnosed, what to expect at the doctor. If you or a loved one are noticing strange neurological changes, don't wait. Here's what a proper diagnostic journey should look like. 1. Neurological exam. Your doctor will check your reflexes, muscle strength, vision, coordination, and memory. 2. Brain imaging, MRI. Magnetic resonance imaging is the gold standard. It gives detailed images of the brain, showing tumors, swelling, or bleeding. CT scans may also be used, especially in emergency settings. 3. Biopsy, in some cases. If imaging shows a mass, a small tissue sample may be taken for lab analysis. This confirms the exact type of tumor, which is critical for choosing treatment. What you should say to your doctor. I've noticed changes in my memory, balance, vision. Could it be neurological? Can we do imaging to be sure? Too often, symptoms are dismissed, but you are your best advocate. You must speak up, even if it feels uncomfortable. Why early detection is a game changer. Gliomas don't always cause pain. They don't always grow fast, but once symptoms start, things can move quickly, especially in seniors. Early diagnosis can mean more treatment options, better surgical outcomes, less risk of permanent damage, and in some cases, extended life. Here's the truth. Gliomas are not always curable, but they are treatable, especially when found early. And the sooner you know, the more control you have. Don't let shame or fear delay you. Many older adults are afraid to speak up. I don't want to bother anyone, it's probably nothing. I'm just getting old. But you deserve clarity. You deserve answers. Because waiting too long could mean less independence, less time, and fewer options. I've seen it again and again in my clinic. Good people who waited too long. And I've also seen the difference early action can make. It changes everything. How is glioma treated in seniors? Treatment decisions for glioma aren't one size fits all. They depend on the tumor's type, size, location, and most importantly, your overall health. Here are the most common treatment options. Surgery. If the tumor is accessible and operable, surgery is often the first step. In some cases, surgeons can remove most or even all of the tumor. But with gliomas located deep in the brain, full removal isn't always possible. Radiation therapy, often used after surgery to kill remaining cancer cells. It's also an option if surgery isn't safe due to age or location. Newer techniques like stereotactic radiosurgery are more targeted, with fewer side effects. Chemotherapy may be given orally or intravenously, depending on the type of glioma. Not all gliomas respond well to chemo, and side effects can be tough for seniors. But in some cases, it adds valuable time and symptom relief. Supportive therapies, physical therapy, occupational therapy, and speech therapy can help maintain independence. Anti-seizure medications and corticosteroids may also be prescribed to manage symptoms. Important reminder, every senior is different. Some may benefit from aggressive treatment, while others may prioritize quality of life. There's no shame in either path, only the importance of informed choices. Nutrition, brain health, and healing. This channel, Dr. Thomas Senior Nutrition, is built around one belief. Food is not just fuel, it's medicine. Here are 3 nutrition strategies that may support brain health and healing during or after treatment. Anti-inflammatory diet. Focus on leafy greens, berries, fatty fish like salmon, turmeric, and olive oil. These foods help reduce inflammation, a key driver of brain aging and tumor progression. Hydration and electrolyte balance. Seniors often forget to drink water, but dehydration makes everything worse. Fatigue, confusion, even headaches. Add lemon, cucumber, or electrolyte packets for taste and retention. Avoid ultra-processed foods. Minimize added sugars, processed meats, and artificial additives. These can negatively affect cognitive function and immune response. Bonus. Herbal teas like ginger, ginkgo biloba, and green tea may offer additional brain-boosting benefits, but always consult your doctor before starting new supplements. Caregiver and family support, the silent heroes. When someone is diagnosed with glioma, it impacts more than just the patient. It can shake the entire family. Here's how loved ones can make a difference. Notice the subtle changes. Is mom repeating herself more often? Is dad more withdrawn or off balance? Don't dismiss it as normal aging. Speak up. Attend appointments. A second set of ears helps catch details the patient may miss. Ask questions, take notes, be proactive. Provide emotional safety. This diagnosis is scary. Let them cry. Let them vent. Sometimes, just sitting together in silence is the best medicine. Plan for practical support. Help organize transportation, meals, medications. If needed, Explore home health aids or occupational therapy early, before a crisis. Caregivers, this is for you too. Don't forget to care for yourself. You cannot pour from an empty cup. Mindset shift, from fear to ownership. The idea of a brain tumor can be terrifying, but fear left unchecked becomes paralysis. You are not powerless, even in the face of a difficult diagnosis. Kelley Mack's life was a beautiful story, full of promise, creativity, and heart. And while glioma stole her far too soon, her memory, her impact, and her story live on, as a reminder for all of us to pay attention, to speak up, to protect our minds while we still can. This is Dr. Thomas Senior Nutrition, where we turn experience into wisdom and where seniors reclaim control of their health, one habit at a time. Until next time, stay sharp, stay proactive, and never stop believing in your vitality.